Welcome back to Things I Know Nothing About, the show where we dive deep into complex topics and try to make sense of them, even when we're starting from scratch. Today, we're tackling a genuinely fascinating and frankly quite significant shift in U.S. health policy that has ripple effects across the entire nation. We're talking about Robert F. Kennedy Jr.'s tenure as the Secretary of Health and Human Services.
It's such a wild turn of events, isn't it, Kennedy? A figure long associated with vaccine skepticism and environmental activism is now at the helm of the very agencies responsible for public health, including the CDC, FDA, and NIH. His appointment under President Trump's second term, confirmed in early 2025, has definitely raised a lot of eyebrows and set the stage for some pretty dramatic changes that we're already starting to see unfold.
Absolutely. And the description of this episode outlines some really specific claims that we need to dissect. We're going to examine whether Kennedy has indeed directed the CDC to revise its stance on vaccines and autism, look into reports of cuts to mental health and substance abuse grants, and scrutinize how he might be reshaping FDA policy. We'll also connect these changes to the troubling spread of measles outbreaks and explore why, even within Trump's own inner circle, there might be efforts to rein Kennedy in.
It's a massive plate of topics, but each one is crucial for understanding the evolving landscape of public health in America. We'll be digging into the peer-reviewed evidence, distinguishing between absolute and relative risks, and always looking for those crucial details about methodology and sample size. Our goal, as always, is to present the strongest steelman argument for every perspective before we try to make sense of the evidence.
Precisely. Let's start with what is arguably one of the most controversial aspects of Kennedy's public health stance, the claim that he's directed the CDC to revise its long-held position that vaccines do not cause autism. This is a topic that has generated immense public debate for decades, and his influence here could be truly profound.
That's right, Alex. From the moment he was sworn in as the 26th Secretary of HHS in February 2025, Kennedy made it clear that one of his primary missions was to address what he termed the childhood chronic disease epidemic. He stated publicly that he's been praying for 2 decades to solve this, and his past work with organizations like Children's Health Defense has consistently promoted the idea of a link between vaccines and autism, despite the overwhelming scientific consensus.
So, while there might not be a direct, publicly released official directive that says, CDC, change your stance on vaccines and autism immediately, how are we seeing this potential shift manifest? What specific actions or statements suggest a reevaluation is underway?
Well, one of the most significant moves was the announcement in June 2025 that HHS was reconstituting the Advisory Committee on Immunization Practices, or ACIPI. The stated goal for this reconstitution was to restore public trust in vaccines. Now, on the surface, that sounds like a positive aim. However, the appointment of new ACIP members in September 2025 has been widely interpreted by some as an effort to introduce voices that are more aligned with Secretary Kennedy's skepticism about vaccine safety. This could absolutely lead to a re-examination of established positions, even if it's not a direct order to change a conclusion. It's more about shifting the narrative and the panel that advises on these crucial matters.
That's a crucial distinction. It's not necessarily a direct reversal, but a change in the composition of the advisory body that shapes these recommendations. But let's be absolutely clear for our listeners. What does the overwhelming, peer-reviewed scientific evidence actually say about the link between vaccines and autism?
The scientific consensus is unequivocally clear. Vaccines do not cause autism. This isn't based on a handful of studies. It's the result of extensive epidemiological research conducted across multiple countries involving millions of children over decades. These studies have consistently found no link between childhood vaccinations, including the MMR vaccine, and autism spectrum disorder. Researchers have meticulously examined vaccine schedules, individual vaccines, and even specific ingredients like thimerosal, which, it's worth noting, has been removed from most childhood vaccines in the US anyway.
So when we talk about methodology and sample size, which are critical for robust scientific findings, what kind of studies are we referring to here? How strong is this body of evidence?
We're talking about studies with incredibly robust methodologies and massive sample sizes. For example, there was a landmark 2002 Danish study that included over 500,000 children. The Institute of Medicine, now the National Academy of Medicine, published a comprehensive report in 2004. More recently, a 2013 meta-analysis combined data from 5 million children, and a 2015 study in JAMA looked at nearly 96,000 children. These studies don't just compare vaccinated versus unvaccinated children, they control for a huge array of confounding factors like socioeconomic status, parental age, and pre-existing conditions. The sheer scale and consistent findings across these diverse studies give them exceptionally high statistical power to detect even the smallest associations. The absence of a statistically significant association across such a vast and well-designed body of work indicates there's no clinically significant link.
And it's important to remember where this initial concern about a vaccine autism link even came from. It wasn't from robust science, was it?
No, it certainly wasn't. The initial scare largely originated from a 1998 study published in The Lancet by Andrew Wakefield. That study, which claimed a link between the MMR vaccine and autism, was later fully retracted due to scientific misconduct, undisclosed financial conflicts of interest, and outright falsification of data. Subsequent investigations revealed that Wakefield acted dishonestly and irresponsibly, ultimately leading to him being struck off the medical register. It's a stark reminder of why rigorous peer review and transparency are so vital in science.
So, if we were to construct the strongest steelman argument for a vaccine autism link, trying to represent the other side's view as fairly as possible before debunking it, what would that argument look like? What are the genuine concerns that lead people to believe there might be a link?
The strongest steelman argument often centers on the temporal association. Parents frequently notice the emergence of autism symptoms around the same time their toddlers receive routine vaccinations. This coincidence can naturally lead to a suspicion of causation. Proponents also point to the increasing rates of both vaccine uptake and autism diagnoses over time, suggesting a potential parallel. They might also cite anecdotal evidence from other parents or express concerns about the sheer number of vaccines given to children, the cumulative effect of vaccine ingredients, or the idea that too many too soon could overwhelm a child's developing immune system. These are all very understandable concerns from a parent's perspective.
And how do we as science-minded individuals address and debunk those understandable concerns with the evidence we've just discussed?
While that temporal association is indeed observed, it's crucial to remember that correlation does not imply causation. Autism symptoms typically manifest in toddlers, which naturally coincides with the period when many routine childhood vaccinations are administered. Rigorous scientific studies, however, have not found a causal link to support this temporal observation. Furthermore, the perceived increase in autism diagnoses is largely attributed to broader diagnostic criteria, increased awareness among parents and pediatricians, and better screening tools rather than an actual increase in incidence caused by vaccines. And regarding the too many too soon argument, a child's immune system is constantly exposed to far more antigens from the environment and common illnesses than from vaccines. It's incredibly robust and capable of handling vaccine challenges without being overwhelmed. The immune system is constantly fighting off bacteria and viruses in the environment, making vaccine antigens a relatively small challenge in comparison.
It's important to acknowledge that even when debunking, there's often something that the proponents of a claim got right. In this case, what positive outcomes or valid points, if any, have come out of the discussion around vaccines and autism, despite the ultimate scientific conclusion?
That's a great point, Alex. While the vaccine autism link is scientifically disproven, proponents of the link have undeniably raised public awareness about the rise in autism diagnoses. This is a legitimate public health concern, regardless of its cause, and increased awareness has led to more research into the causes and treatments for autism. They have also perhaps inadvertently emphasized the need for rigorous and ongoing vaccine safety research. Public health bodies continuously monitor vaccine safety, and this scrutiny, even if driven by misinformation, reinforces the importance of that vigilance. It's an essential part of maintaining public trust, even as the science overwhelmingly stands firm against the autism link.
Moving on from vaccine policy. Another significant claim about Secretary Kennedy's tenure is that he has cut mental health and substance abuse grants. This is an area with profound implications for communities across the country. What does the research tell us about these alleged cuts?
This is an incredibly important area. especially given the ongoing mental health crisis and the opioid epidemic. Immediately following Kennedy's swearing in, President Trump, with Kennedy by his side, signed an executive order titled Establishing the President's Make America Healthy Again Commission. This order's stated goal is to investigate and address the root causes of America's escalating health crisis, with a focus on childhood chronic disease. While this executive order doesn't explicitly mention cuts to mental health or substance abuse grants, Kennedy's stated priorities for HHS have heavily emphasized tackling chronic childhood diseases and addressing overprocessed foods that are fueling obesity.
So the shift in focus is clear, but how does that translate into actual budget reallocations or cuts to specific programs? Are there any concrete indications of funds being diverted?
Reports from early 2026 do indicate that the HHS budget proposal under Secretary Kennedy has indeed reallocated funds. While obtaining granular line item details on specific cuts to mental health and substance abuse grants requires an in-depth budget analysis, several congressional testimonies and preliminary budget documents suggest a clear shift in funding priorities. The focus seems to be moving towards preventative measures against chronic diseases, which is a major area championed by Kennedy. Critics have voiced significant concerns that this reallocation, while potentially boosting other areas that Kennedy prioritizes, could lead to a tangible reduction in services for existing mental health and substance abuse programs. Discussions around the HHS budget have even included proposals to consolidate or streamline certain grant programs, which could effectively reduce overall funding or change the eligibility criteria for recipients of these vital services, even if not an outright cut.
And what would be the potential impact of such reductions? When we compare this to a baseline, what are we looking at in terms of real-world consequences for people who rely on these services?
Any significant reduction or reallocation of funds from mental health and substance abuse grants could have substantial negative impacts. Many established mental health and substance abuse programs rely on consistent funding to operate effectively. A reduction would almost certainly mean fewer people receiving care compared to the baseline, which is the current level of service provision. We could see increased untreated conditions, longer waiting lists for therapy and treatment, and potentially higher rates of overdose, homelessness, and incarceration for individuals struggling with these issues. The clinical significance of such cuts would be measured by very real human metrics: increased waiting lists, higher rates of relapse, poorer overall mental health outcomes in affected communities, and a strain on emergency services that would pick up the slack from preventative and early intervention programs.
So it's not just about numbers on a spreadsheet, it's about the erosion of a safety net for vulnerable populations. Let's shift gears now to another major area under Kennedy's purview, the Food and Drug Administration. The claim is that he is reshaping FDA policy. How is his influence being felt within such a powerful regulatory body?
As HHS Secretary, Kennedy directly oversees the FDA, so his influence on its policy is not just expected but inevitable. His past criticisms have often focused on the FDA's drug approval processes, which he has sometimes characterized as too fast or not thorough enough, particularly concerning vaccines. He's also expressed concerns about the FDA's regulatory approach to food and environmental toxins. Early actions under his tenure include reports of a more aggressive stance on food additives and increased scrutiny of pharmaceutical advertising.
Can you give us some more concrete examples of how this reshaping might look? For instance, what about drug approval processes, which are incredibly complex and impactful?
Absolutely. Kennedy has historically expressed skepticism about the speed and thoroughness of some drug approval processes, especially in the context of vaccines. Reshaping FDA policy in this area could involve calls for more extensive pre-market testing, longer observational periods for new drugs, or even different, more stringent evidentiary standards for approval. In August 2025, the FDA named a top HHS lawyer as chief counsel, which certainly suggests an effort to align the FDA's legal and policy direction more closely with the broader HHS agenda under Kennedy.
So, if we apply our Steelman framework here, one could argue that increased scrutiny and longer testing periods might lead to safer drugs, right? What's the potential trade-off if the FDA does move in that direction?
You're right. The Steelman argument for more rigorous testing is that it could potentially increase perceived safety and reduce the risk of unforeseen side effects. However, the potential impact of such changes is significant. While potentially increasing perceived safety, a slower, more arduous approval process could significantly delay the availability of new life-saving medications and vaccines. This would increase the time patients suffer from diseases and, in some cases, lead to preventable deaths. The baseline for drug approval often involves a delicate balance between speed and safety, aiming to get effective treatments to patients as quickly as possible while ensuring they are safe. Shifts could dramatically alter this balance, potentially prioritizing perceived safety over timely access to critical therapies.
Beyond drug approval, Kennedy has also been vocal about overprocessed foods. How might this translate into changes in FDA policy regarding food safety and additives?
This is another area where we could see significant changes. Kennedy's stated mission includes addressing overprocessed foods and their link to chronic disease. This could lead to a more aggressive FDA stance on food additives, artificial ingredients, and pesticide residues. We've already seen reports of increased scrutiny in this area. From a public health perspective, increased scrutiny could lead to the removal of certain ingredients from the food supply that are deemed harmful, potentially improving public health by reducing exposure to substances that might contribute to chronic conditions.
That sounds like it could be a positive development, but are there any potential downsides or challenges with such a shift?
While the potential health benefits are clear, there could definitely be challenges. Such a move would likely face significant pushback from the food industry, which relies on many of these additives for preservation, taste, and cost-effectiveness. It could also lead to increased food costs for consumers as manufacturers reformulate products and potentially limit consumer choices in the short term. The FDA would need to carefully balance the scientific evidence of harm against economic impacts and practical implementation challenges. There could also be increased scrutiny on medical devices, particularly those with perceived links to chronic conditions, though less information is available on specific changes in that area yet.
So we're seeing potential shifts across the board from how drugs are approved to what we eat. Now, let's connect these policy discussions to a very tangible and concerning public health development: the spread of measles outbreaks. The description notes that these outbreaks are spreading while RFK Jr. is reshaping policy. Is there a direct link here?
The data from public health organizations indicates a genuinely concerning trend in measles cases. Even before Kennedy's tenure, global and national measles cases had seen an uptick in recent years, largely attributed to declining vaccination rates in certain populations and increased vaccine hesitancy. Reports from early 2026 confirm that measles outbreaks are indeed spreading in various regions. We're seeing CDC alerts highlighting localized outbreaks in several states, with cases exceeding previous annual totals in some areas. These outbreaks are almost invariably linked to communities with lower vaccination coverage, where the virus can find fertile ground to spread.
When we talk about measles, the danger isn't just to the individual, but to the community, especially those who can't be vaccinated. Can you explain the absolute versus relative risk of measles in the context of these outbreaks?
Absolutely. While the absolute number of measles cases in a country might seem small compared to the general population, the relative risk for unvaccinated individuals in an outbreak area is extremely high. If an unvaccinated person is exposed to measles, their infection rate can be as high as 90%. Measles is one of the most contagious diseases known. Its R0, or basic reproduction number, is incredibly high, typically between 12 and 18. This means one infected person can spread it to 12 to 18 other susceptible unvaccinated people. So, while the absolute number of cases might not be in the millions, the relative risk within unvaccinated communities is a ticking time bomb, leading to rapid and dangerous spread.
And how does this connect to the policy shifts we're discussing under Secretary Kennedy? Is there a direct causal link, or is it more of an exacerbating factor?
It's more of an exacerbating factor, but a very powerful one. A decline in vaccine uptake, fueled by misinformation and distrust in public health institutions, directly contributes to measles outbreaks. If HHS, under Secretary Kennedy, shifts its communication or policy in ways that further erode trust in established vaccine science, it could absolutely exacerbate these outbreaks. For example, the reconstitution of ACIP and any perceived wavering on the CDC's strong pro-vaccine stance could contribute to increased vaccine hesitancy among the general public. When public health messaging becomes muddled or contradictory, it provides fertile ground for the spread of highly contagious diseases like measles, which thrive in populations with insufficient herd immunity. His personal history with vaccine skepticism, even if not directly leading to a policy of reducing vaccine access, can influence public perception and trust in a way that contributes to lower uptake.
So, the indirect effects of policy and messaging on public trust can have very direct and devastating public health consequences. This leads us to our final point, the claim that even Trump's inner circle is trying to rein Kennedy in, given his appointment by Trump. This suggests some internal tension. What's the evidence for this?
This is an intriguing aspect of the story. President Trump's appointment of Robert F. Kennedy Jr. as HHS Secretary was controversial from the start, precisely because of Kennedy's prominent anti-vaccine stance, which diverges significantly from traditional public health consensus, even within some conservative circles. While President Trump himself has historically expressed some skepticism about vaccines and generally supported Kennedy's direction on making America healthy again, there have been clear reports and observations suggesting internal tensions. Elements within the broader Republican establishment and individuals associated with the Trump administration have reportedly voiced concerns.
What are the core reasons for these concerns among Trump's inner circle or the wider GOP, especially if Trump himself was the one who appointed Kennedy?
The concerns often center on several key issues. Firstly, there's the erosion of trust in science. Many within the GOP recognize the importance of established scientific institutions and worry that Kennedy's appointment and policies could undermine public trust in crucial agencies like the CDC and FDA. This could have serious implications for future health crises, making it harder to implement effective public health measures. Secondly, there's the political fallout. Positions perceived as anti-science or directly leading to increased preventable disease outbreaks like measles could become a significant political liability for the administration, potentially costing votes. And finally, there's the economic impact. Significant shifts in FDA policy, particularly around drug approval or food regulation, could have substantial economic consequences for industries that are generally supportive of Republican administrations. They don't want to alienate powerful sectors.
These aren't just whispers. Then how do these reining in efforts typically manifest if they're not always overtly public?
These efforts might not always be overtly public, but they can take various forms. You might see advisors attempting to moderate Kennedy's public statements or policy proposals behind closed doors. There could be strategic appointments of deputies or other key personnel within HHS and its agencies who hold more mainstream public health views, effectively creating checks and balances. We might also see leaks to the press expressing concerns from within the administration, signaling internal dissent without direct confrontation. For example, a number of op-eds and statements from public health experts and even some former Trump administration officials have openly expressed dismay over Kennedy's appointment, citing a potential for catastrophic policy shifts and a profound erosion of trust in science. This public pressure, combined with any internal lobbying, suggests a multi-pronged effort to temper his influence and guide his policies closer to mainstream scientific consensus.
This has been an incredibly comprehensive look at what's happening within HHS under Secretary Kennedy, from the nuanced shifts at the CDC regarding vaccines to the potential reallocation of mental health funds, the reshaping of FDA policy, and the worrying rise of measles outbreaks. It's clear his tenure is already making waves.
It truly is a complex tapestry of policy, science, and public perception. What stands out to me is the tension between established, peer-reviewed scientific consensus and a new administration's desire to reshape health rules. While skepticism and a desire for accountability are healthy in any system, when they contradict overwhelming evidence, the consequences can be profound, as we're seeing with the measles outbreaks. It highlights the critical importance of distinguishing between legitimate scientific inquiry and the promotion of disproven theories.
And the dynamic within the administration itself, with elements reportedly trying to temper Kennedy's influence, speaks volumes about the challenges of navigating such a controversial appointment. It underscores that even within political power structures, there's a recognition of the potential risks associated with undermining public trust in science.
Absolutely. Our health rules ultimately should be guided by the best available evidence, scrutinizing every claim with rigor, and understanding the real world impact of every policy decision. It's about protecting public health, and that requires a foundational trust in scientific institutions and processes. This episode has certainly given us a lot to think about regarding where that trust is being placed and where it might be eroding.
Indeed, and that's our deep dive into Robert F. Kennedy Jr.'s impact as HHS Secretary. Thank you for joining us on Things I Know Nothing About. We'll see you next time.